Good evening, everyone. On behalf of Dr. Agarwal's Institute of Optometry, I hasten to welcome each and every one of you. So, I welcome you all once again for the 13th episode of Optometry series. The topic for today is ocular emergency. I would like to welcome my co-team members, Zulaiha ma'am and Ms. Meenakshi. Hi, ma'am.
Hi, Gunati.
Yes. Ma'am, I would like to ask you about the today's moderator, ma'am. So, Ms. Shramoni ma'am has joined us today. I'm glad to invite her. Hi, ma'am.
Hi.
Yes. So,
Oh,
Zulaiha has to now tell us, so why did you
okay.
bring Shramoni ma'am today?
So I actually
Your
wanted
voice
to have.
are breaking actually. I can't hear properly.
Yes, I think Deepika, you have to switch off your audio.
Okay.
Yes.
So the today's topic is about ocular emergency. So just wanted to have another one set of uh, uh, session where the common people plus the optometry fraternity will get to know. So when we speak about this day-to-day life in OPDs, when we see majorly optometrists are in refraction, other diagnostics and all. So very rarely we used to see different types of trauma. So it is better to have a knowledge about what first aid can be given for what kind of trauma patients. So it's just like a refreshment from our syllabus oriented classes. So just wanted to have a session with one clinical optometrist who is into the day-to-day practice in OPD. So they may have seen many patients with different types of injuries or any other, like say, for example, chemical injury, or it can be a redness, or it can be something which comes from a road traffic accident or from a school somewhere. So traumas are something which are unexpected. It can happen from any place. So through one of my friend, I got the contact of Ms. Shramoni. So when I contacted her, she said, okay, I'll immediately she was saying, okay. And when I spoke to her, then only she said she's going to join Agarwal's Kolkata branch. So I think 2 days back only she had officially joined Dr. Agarwal's. So again, she's like our family. So welcome to Dr. Agarwal, Shramoni. And thank you so much for accepting immediately also. So I know that how I contacted you on your son's birthday. I just called you and it was disturbing you. So thank you so much. So I think we'll hear about Ms. Shramoni from our MC students.
Yes, Deepika.
Good afternoon to one and all, gathered here for 13th Optometry series. The topic of today is ocular emergency. I'm profusely elated to take opportunity to introduce our moderator of the day, Ms. Shramoni Mukherjee, who's recently joined us as senior optometrist in Dr. Agarwal Eye Hospital, Kolkata. She has completed her bachelor degree from West Bengal and master degree from Vinayaka Mission University. She has over 8 years of experience in optometry. She has her experience and excellence in various companies such as Lawrence and Mayo and Lenskart. She has also been working in Eye Care and Research Center, Shankara Netralaya Medical Research Foundation, Spectra Eye Hospital, BBI Foundation, and Ashmi Eye Foundation. She has also been a visiting lecturer in Palin College of Management and Technology. For the past 5 years, she has been working as a senior consultant optometrist at AMRA Hospital. We are grateful to have you, ma'am.
Thank
I,
you.
hear, I hereby welcome today's speaker, Ms. Akshaya Kishore, third year optometry student in Dr. Agarwal Institute of Optometry. I request Ms. Akshaya Kishore to start the presentation.
Thank you, Deepika. I once again welcome Shramoni ma'am. Thank you so much for joining us today, ma'am. Yes, Akshaya, you can start your presentation, Kana.
So, ocular emergencies. What are ocular emergencies? Ocular emergencies are ocular conditions which require immediate intervention and immediate attention. Introduction. Introduction. Ocular emergency is a condition that can cause a sudden loss of or decrease in a person's vision that could lead to a permanent vision loss. And the obvious ophthalmic emergencies would be penetrating injuries, chemical burns, orbital cellulitis, endophthalmitis, sudden profound visual loss, acute anal facial glaucoma, corneal ulcer. The previous literature data has depicted that the ocular injuries of the traumatic etiology are more common seen in male subjects compared to females between the age of 25 and 45 years. And ocular trauma in rural India. An original research article states that ocular trauma, being a major etiology for vision loss, safety measures, and awareness, can markedly reduce occupational accidents. And non-traumatic ocular emergencies seen where corneal ulcers of the bacterial etiology, hygiene measures can reduce them considerably. And this is in rural India. And for urban India, WHO, that is the World Health Organization, has reported 55 million eye injuries, in which 1.6 million people become blind, and have reported the prevalence of ocular trauma to be 2.4% of population in urban India. And the classification of ophthalmic emergency are acute emergency, an urgent case, and a semi-urgent case. Now, what is acute emergency? Acute emergency is the code red of ophthalmic emergency, and it must be treated within minutes, those of which includes chemical burns of the cornea and the conjunctiva. An urgent case. As the name suggests, an urgent case, although not a code red, but it also must be treated within hours. Those of which includes penetrating globe injuries, corneal aberrations, corneal foreign bodies, hyphema, eyelid lacerations, radiant energy burns, Milder's burns, and traumatic optic neuropathy. And the last but not least, we have the semi-urgent case. So it also must be managed, and it must be managed within 1 to 2 days, those of which includes orbital fractures, subconjunctival hemorrhages. And the broad classification of ophthalmic emergency would be acute red eye, acute vision loss, ophthalmic trauma, and acute ocular pain. The acute red eye. The acute red eye is a very common and a non-specific sign. It indicates the visible appearance of the abnormal redness of the globe, lids, or the adnexal structures. And the acute red eye can be caused by various of factors, which includes the infection, allergy, trauma, inflammation, raised intraocular pressure, and dry eye. And if it is due to infection, it can be a keratitis, corneal ulcer, conjunctivitis. And speaking of conjunctivitis, there are many types of conjunctivitis, and the primary cause of conjunctivitis would be viral infection, bacterial infection, chlamydia, allergy conjunctivitis, and chemical irritants. And for trauma, the trauma would cause corneal aberrations, foreign body, chemical injury, subconjunctival hemorrhages. And inflammation would cause scleritis, episcleritis, marginal keratitis, iritis, uveitis, blepharitis. And if it is due to raised intraocular pressure, acute ankylosing glaucoma would be caused. And the patient care for acute red eye. Optometrist's role in acute red eye would be full ophthalmic examination from BCVA, ocular motility, slit lamp examination, ophthalmoscopic examination, and IOP measurement. Then full history taking, which includes the traumatic history, surgery history, allergic history, systemic diseases history, medication history. And the imaging, we would be doing B, ultrasound, and OCT. And for treatment, we would refer them to ophthalmologist. Acute vision loss. Acute vision loss is an important ophthalmic emergency, and it affects patients of all ages. And loss of vision, it can be temporary or permanent. And if it is temporary, the vision loss lasts less than 24 hours. And again, temporary can be monocular or binocular. And monocular temporary vision loss can be caused by retinal emboli, carotid artery disease, giant cell arthritis, retinal vein occlusion, retinal migraine, optic neuropathy, and papilledema. And binocular temporary vision loss would be caused by migraine, head trauma, and occipital seizures. And for permanent vision loss can be caused by retinal artery occlusion, retinal vein occlusion, optic neuropathy, optic neuritis, giant cell arthritis, vitreous hemorrhage, retinal detachments, stroke, and hysteria. And the patient care for acute vision loss would be addressing the root cause of the vision loss and treating the root cause. Acute ocular pain. A painful eye is not normal and it can commonly be associated with various sensations. And the causes of acute ocular pain are glaucoma, hyphema, scleritis, uveitis, endophthalmitis, corneal abnormality, and optic nerve conditions. Neuro-ophthalmic emergencies. And those are indicated by vision loss. Vision loss can be caused by some problem in the optic pathways, which includes the optic nerves, optic chiasm, optic tract, optic radiation, and the occipital cortex. Visual field defect is the level 2 of vision loss, in which the optic pathways can be affected, and that can also be an optic neuritis. And optic nerve ischemia. Ischemic optic neuropathy can be due to vascular insufficiency, and optic disc swelling can also be noted. Optic neuritis. Optic neuritis can be caused by infection, inflammatory, and demyelination. If it is caused by demyelination, it is commonly associated with multiple sclerosis and stroke. Cerebral ischemia can be present with ophthalmic defects depending on the location. Floaters are flashing lights. Floaters can be a slow process, and idiopathic vitreous floaters are a common cause. It can also be an indication of retinal detachments or vitreous detachments. Third nerve palsy. Third nerve palsy with a dilated and unreactive pupil should raise concern for intracranial aneurysms. And cavernous sinus syndrome. Cavernous sinus is a common pathway for the most of the cranial nerves, and the cranial nerves which pass through the cavernous sinus are third cranial nerve, fourth cranial nerve, fifth cranial nerve branch 1, and fifth cranial nerve branch 2, and sixth cranial nerve, along with the carotid artery. So if there is some problem with the cavernous sinus, of course, these associated parts would also be affected. And patient care for neuro-ophthalmic emergency. And optometrist role in neuro-ophthalmic emergency are history taking and past medical history and physical history. And the primary physical examinations would be visual acuity, visual fields, pupils evaluation, extraocular muscles movements, IOP measurement, slit lamp evaluation, and imaging techniques. Open globe injury, or generally called as ophthalmic trauma, is a significant cause of permanent vision loss worldwide. So it can be mainly caused by mechanical ocular injury, which can be open globe or closed globe. If it is open globe, there will be a full thickness full thickness wound of the eye wall. And if it is due to closed globe, there will be a partial thickness wound of the eye wall. An open globe is again caused by lacerations and ruptures. Lacerations are caused by sharp objects, and it is mainly indicated by the using of the eye liquids. And ruptures are mainly caused by blunt objects, and it can be indicated by swelling and edema. And laceration, it is again divided into three levels, in which there is penetrating, perforating, and intraocular foreign body. And the level 1 is penetrating, in which the matter which has caused the injury comes in with a single entrance wound. And perforating is the level 2 of penetrating, in which the object which has caused the injury comes in with an entrance wound and leaves an exit wound. So there would be two wounds in total. Intraocular foreign body is the boss levels of all. If the object which has caused the injury has comes in and left parts of its own inside the globe. So mechanical eye injury, and the classification of mechanical eye injury would be open globe injury, closed globe injury, and closed globe injury can be classified as contusion, lamellar laceration, and superficial foreign body. And open globe injury can be a globe rupture, laceration. Laceration can again be penetrating, perforating, and intraocular foreign body. Chemical burns. Chemical exposures and burns are usually caused by a splash of liquid, and treatment should be instituted immediately. So the emergency treatment would be irrigating the eye using a saline or a ringer lactate solution for 30 minutes. And tap water can also be used in absence of these solutions. And the eyelid speculum and topical anesthesia can also be placed before irrigation. And there can and conjunctival swabbing can also be done to remove any particles. First aid measures. So the first aid measures includes first aid measures for chemical burns includes immediately flushing the eye with water or any drinkable liquid, and the eye should be kept open as wide as possible during irrigating. And the flushing of the eye should at least be maintained for 15 minutes. And if there is a contact lens in the eye, the flushing should be done over the lens immediately. And in case of nose to the eye, then we can apply throat compress without any pressures. And in case of cuts or punctures, do not wash out the eye with water or any other liquid. Do not try to remove an object that is stuck in the eye. And these are the summaries of which we had seen in the previous slides. It includes what should be done, and what are the first aids, and what are the preventive measures, and what is ocular emergency, and what are the classification of the ocular emergencies. And these are my references. Thank you.
Thank you so much, Akshaya. Now I welcome the moderator to share her points. Hi, Shramoni ma'am.
Hi.
Yes, ma'am. So what is your opinion about the PPT ma'am presentation? So your valuable points, please.
That's a wonderful presentation. Almost all things covered in this presentation. It's good. It's really. We have to focus in more about history taking and pupil evaluation. What type of pupillary defect we seen in this case, and we have to see what kind of redness, how we detect this the redness cause for.
Yes, ma'am. You're not audible, ma'am. Yeah.
Hello.
Now you're audible, ma'am. Yes.
Almost all things covered in this presentation. Any question about this?
Yes, ma'am. There are a few questions in the chat box. I welcome Meenakshi to kindly ask the questions that is present in the live chat. I request the audience to kindly post any questions in the live chat so that we can clarify the doubts.
Hi, ma'am. Okay, we have a question in Zoom chat box. What are the complications of eye trauma?
After trauma, there may be lot of complication will be there. Sometimes retinal detachment will be happen. Sometimes neuroretinal problem will be happen. So if it is penetrating trauma, that then some corneal rupture may happen. Corneal erosion, corneal rupture may happen.
Thank you, ma'am.
If there's some injury like chemical injury, we have to detect which type of chemical is there. It is alkaline or acidic. The alkali is more coarse than acid things. So we have to aware about the chemical injury, which type of chemical insert in our eyes.
Yeah. Next question is, how do you rate the severity of ocular conditions?
Sorry?
How do you rate the severity of ocular conditions?
How do I
rate? Yeah, they have classified into emergency, urgent, and semi-urgent cases, right?
Okay. Actually, I don't got the point. Actually, there are so many evaluation are there. Now we have to do proper slit lamp evaluation, the cornea and others thing we have to see. And after dilatation, we have to check the retina also. And sometimes for trauma, we have to see the gonio. In some cases, we have to see gonio cause sometimes neovascularization are there after trauma in our angle. So this is the thing we have to check.
Yeah, ma'am. Next question is, how long the palsy can be left untreated? Or what defects can be seen if the palsy is not treated immediately?
Some palsies, actually palsies things are totally neurological things. Most of the times we refer to neurooptal or neurologist. Some palsies are they treated by actually neurologists, the facial palsy, and for third nerve palsy, generally we refer to neurologists. And if this is actually not that much urgent thing, but the immediate emergency, this is not immediate emergency. We can wait for 1 to 2 days or 1 week for that treatment.
Thank you, ma'am. And next question is, grossly, how do we start managing patients with penetrating injuries?
For penetrating injuries, we have to send patient to surgeon and the globe. We don't press globe, and if we have to avoid the lactation of cornea that time.
Okay, ma'am. Next question is, how do we prevent ocular injuries in workplace?
Sorry?
How do we prevent ocular injuries in workplace?
We have to protect him. We have to wear the protecting gear like glasses, and if some welding cases, we have to wear glasses in some and that's why that's time. That's how we avoid injuries.
Thank you, ma'am. Julia, ma'am, do you have any questions, ma'am?
So I don't have any major questions. So just wanted to add few points regarding the existing questions. So there are different types of injuries which can happen at different places. So as Shramoni said, so there are few injuries which can happen related to the orbital bone. So which can in turn lead to the nerve damage and lead to diplopia, some different kinds of alignment related problems. But there are few penetrating and blunt trauma which can obviously damage the ocular structures, external structures, internal structures, and there can be some part of the trauma related things also which can be stuck inside, which we call it as intraocular foreign bodies. So there are damages to each and every structure as immediate damage as well as long-term complication. So there are few conditions which can lead to chemical reactions when an intraocular foreign body like metals, iron metal or something which can be stuck inside. So the passage where it has gone, that also will become a laceration, trauma related, all those can happen. Plus that reaction which is happening from that metal also will lead to severe damage. So it's like depending on what trauma, what type of trauma, what has happened, depending on that only we need to rate the severity. Plus we will be seeing about other complications associated. So like gonioscopy is necessary to check for hyphem also. So this can lead to a secondary glaucoma. So like that, there are many things which can happen, sudden immediate response as well as long-term complications also.
Thank you, ma'am. We just have one more question in YouTube. What is the visual outcome for perforating injuries?
For perforation, depends upon the commonly alkalis will have this perforating injuries. So if the cornea is involved, obviously there is going to be a massive vision deterioration. So this visual deterioration can happen at different levels. So the amount of chemicals which is in contact with the cornea, that will be the that will grade the severity. So again, obviously, when there is a chemical injury, patient will not be able to properly respond for the vision. So we have to give first aid, we have to treat the case, and then only we have to check. And ultimately, the patient may lead to corneal opacity, depending upon.
Thank you, ma'am. We have one more question again. What are the ocular injuries caused at home during cooking? Ocular injuries occurring at home while cooking, ma'am.
If oil is on the eye, hot oil or some hot thing, we have to wash eye properly. And now if there is some cornea issue, that time we have to manage it by erosion. If corneal erosion is there, we have to give proper treatment for that. Most of the time, cornea affected, corneal burn will be there. Some conjunctival burn will be there. Sometimes crackers case is also same. Crackers injuries are also there. Then same type of cases.
Thank you, ma'am. Julia, ma'am, would you like to add any points, ma'am?
So about injuries, I think first aid all of us will know. But one thing we wanted to, as a professional, we need to stress the workplaces related injuries to those kind of industries. When we say each and every industry will have their own kind of workplace and setup, and things are different. So we as a professional, we have to give awareness about this, and we have to stress in some way that the government is also checking their industrial, what do you say, the hazards, to avoid those hazards. What are the preliminary things they need? What are the safe things they provide to their employees? So all those we have to see. So it is not only industries. When we say farmers also can be prone to these kind of injuries. Normal vegetative injuries can lead to fungal ulcers also. So like that, there are each and every place there are possible chances of trauma. So workplace related safety measures should be taken out. So this is one thing as a professional we can spread this word.
Thank you so much, ma'am. Adding to your point, usage of personal protective equipment should also be encouraged by us, ma'am.
So whatever industry, they have to have their own protocol. What are the safety measures they have to take? The place also should have water, fire extinguishers, everything should be available in their area. And related to the material what they are using, the employees should be provided with the safety equipment. This is what is mandated.
Thank you, ma'am. Gomati.
So with the question and answer session, we come to a conclusion of today's episode. So the take-home message is prevention is always better than cure. So please follow the protocol at the workplaces to avoid any kind of injuries. If so, any injury has happened, kindly seek medical attention immediately. So that is the take-home message for today. So with this, we come to a conclusion of today's episode. Thank you so much, Shramoni ma'am. Thank you so much, Zulekha ma'am and Meenakshi for joining us today. And Shramoni ma'am, we would like to have you at another wonderful session. We'd like to host you at another wonderful session. So once again, welcome to Dr. Agarwal's family, ma'am.
Okay, thank you. Thank you all.
Thank you. So dear audiences, thank you so much for your continued support towards the Optometry series. If you have any questions regarding the today's session, please post it in the comment box. We'll get back to you with the answers. So to know more about the updates at Dr. Agarwal's Institute of Optometry, do follow our LinkedIn page, Instagram, and Facebook. If you like this video, share with your friends and give a thumbs up. To know more about the questions or admission process and everything, the number is given in the description box. The links for the Instagram pages is also provided in the description box. With this, we'll meet you in the next time. Thank you so much for joining. Tata, bye-bye.